want to act as a patient, and I will be an undergraduate medical student. I will ask you questions about your complaints. At the end of this conversation, I want you to then grade me on my quality of history taking and provide recommendations for improvement.
Of course, I can help with that. Please go ahead and start asking your questions. I'll respond as if I were a patient.
Good morning, Mr. Cho. How can I help you today?
Good morning. I've been having some pain in my lower back for the past few weeks, and it's been getting worse.
And how long has this been? And
You're
was there a
welcome.
bit of an injury before?
Yes, I did have a minor injury about a month ago. I slipped and fell on some stairs, landing on my back. The pain has been on and off since then, but recently it has become more constant and severe.
Does it go down your legs?
Yes, the pain sometimes radiates down my right leg, especially when I sit or stand for a long time.
Is there any associated numbness or weakness in the feet?
Yes, I've noticed some numbness and tingling in my right leg, particularly around my calf and foot. There isn't significant weakness, but my leg does feel a bit weaker than usual.
And did you have any pain before this fall?
No, I didn't have any back pain before the fall. This started after the injury.
And you are otherwise fit and healthy?
Yes, apart from this back issue, I'm generally in good health.
Okay. Do you take any medication, especially for this recent pain?
I've been taking over the counter painkillers like ibuprofen, but they don't seem to be helping much anymore.
Are you allergic to any medication?
No, I'm not allergic to any medications.
What kind of job do you do?
I work as a software developer, so I spend a lot of time sitting at a desk.
Do you do any sports or recreational activities?
I used to play tennis regularly, but I've stopped since the injury because of the pain.
What are your concerns about your pain currently?
My main concern is that the pain seems to be getting worse and it's affecting my daily activities and sleep. I'm also worried about the numbness and tingling in my leg.
And what are your expectations for today?
I hope to get some advice on managing the pain and understanding what might be causing it. Ideally, I'd like to know if there's anything specific I can do to alleviate the symptoms or if I need further tests or treatments.
Okay, I think I understand your concerns. I think you probably may have a minor injury to your back. However, since you're concerned, I think it would be a good idea to do an MRI scan to determine whether you've had a prolapsed disc. What we will do is we get that organized. Is that okay with you?
Yes, that sounds like a good plan. I'd appreciate getting an MRI to understand what's going on. Thank you.
Okay, thank you. Okay, now give me feedback on my history taking.
Certainly. Here are some observations on your history taking. Strengths. 1. Open-ended questions. You started with an open-ended question, allowing me to describe my symptoms in my own words. 2. Specific probing. You ask specific follow-up questions about the pain's radiation, numbness, and weakness, which are critical in assessing back pain. 3. Past medical history. You inquired about previous pain and the incident that might have caused the current issue. 4. Medication and allergies. You checked for current medications and allergies important for planning treatment. 5. Lifestyle and occupation. You asked about my job and recreational activities, which can influence back pain. 6. Patient concerns and expectations. You addressed my concerns and expectations, ensuring a patient-centered approach. Areas for improvement. 1. Pain characterization. You could have asked more about the pain's nature, sharp, dull, burning, duration, and any factors that alleviate or exacerbate it. 2. Systemic symptoms. It would be beneficial to ask about other systemic symptoms, like fever or weight loss, to rule out more serious conditions. 3. Functionality impact. Probing further into how the pain affects daily activities in more detail could provide additional insights. 4. Review of systems, including a brief review of other systems, e.g., gastrointestinal, urinary, can help identify any related issues. Recommendations: 1. Expand on pain history. Incorporate questions about the pain's character, timing, and any specific movements or activities that influence it. 2. Broader symptom inquiry. Ensure you cover a review of systems to catch any related or systemic symptoms. 3. Functionality and daily life. Ask about the impact on specific daily activities and sleep to understand the extent of the issue better. Overall, your history taking was thorough and patient focused. With a few additional questions, you can gather an even more comprehensive history.